Hello everyone, my name is Dr. Syed Harun Al-Habshi. I'm based in sunny Singapore and I'm a consultant psychiatrist in private practice. Obviously, as you all would know, as a psychiatrist, I'm a medical doctor who's trained to care for patients who are in need of mental health care. Now, in this module, I'm excited to share with you what I know about mental health and also the foundations of mental health literacy so that it supports your journey as a peer support leader in future. It's heartening to know that you guys are here to expand your knowledge and are keen to be able to help others who are most dearest and closest to you, and I'm actually very excited to be able to support you in this journey. In this module, we want to address some common misconceptions about mental health. In my work as a psychiatrist, I've come across many misconceptions or misunderstandings that my clients and their caregivers may have had about mental health. What these do is that these can prevent them from seeking and receiving the very help that they need. And therefore, as a peer support leader, it's important for you to be able to have an awareness of your own assumptions and unconscious biases. These misconceptions can come from perhaps the messages we have heard from shows, from social media, or conversations with others. And when we ourselves internalize these messages, we may end up making very wrong assumptions or have our own biases towards people who are already in themselves struggling with mental health issues. The truth is, we are all complex creatures, correct? And when we try to put someone's emotions, behaviors, or personality under a certain label, we are actually reducing them as individuals. That can be very dangerous, presumptuous, and that can hurt. We're also losing an opportunity to be able to learn more about their own diverse experiences and backgrounds. Obviously, it affects people when we make assumptions about them. Just the same way, when it may hurt us when other people make assumptions about ourselves as well. And this is why we need to be very aware of our own assumptions, our own biases, in our work as we want to help others who are in need or in crisis, or even those in despair. We need to be able to have awareness of our assumptions before we step forward to help others. Let me introduce you to some common myths when we talk about mental health issues. I'm sure many of you out there will wonder whether these are true or whether these are false. And sometimes, I can understand why you might be on the fence, and I will not make assumptions about you either. So let's do this together by answering a few simple questions. What I want is for you to be honest with yourself, question your own biases, so that it becomes a point of reflection for you in the future, especially when you are confronted with specific situations and you are in a position to want to help others.